Good to go.
Ladies and gentlemen, a very good morning. Namaste. Welcome to Canada India Foundation's 18th session of our virtual webinar speaker series on Ayurveda. My name is Satish Thakkar, Chair of Canada India Foundation, and we have our national convener, Mr. Ritesh Malik, and Dr. Harish Verma, President, Canadian Ayurvedic Practitioners Association with us. And today we have a very special guest, Mr. Manish, Consul General of India, Vancouver. Mr. Manish is closely connected with the Indo-Canadian community, especially in Vancouver area, and has been supporting CIF's activities in the West End for promoting better Canada-India relations. A very warm welcome, Mr. Manish, and thank you so very much for joining, sir. And friends, today's our expert speaker is Dr. Narayan G. Shahane. He will appraise us on Ayurvedic management of benign prostate enlargement and urological disorders. Benign prostatic hyperplasia, which is called BPH, also called prostate gland enlargement, is a common condition as men get older. An enlarged prostate gland can cause uncomfortable urinary symptoms such as blocking the flow of urine out of the bladder. It can also cause bladder, urinary tract, or kidney problems. This is a common problem that affects the quality of life in approximately 1/3 of men older than 50 years. And BPH is histologically evident in up to 90% of men by the age 85 years. Around 25% of the men in Canada over the age of 50 have BPH, and that increases to 90% for men in their 80s. Worldwide, approximately 30 million men have symptoms related to BPH, and by 70 years of age, almost all men will have some prostate enlargement. So the objective of today's webinar is to understand how 6,000-year-old Ayurveda as an effective alternative health system can provide solution to cure or prevent this disease, and how we can change our lifestyle as per Ayurveda. And friends, this Ayurvedic lecture series is in partnership with Canadian Ayurvedic Practitioners Association, Consul General of India in Toronto, and Vedic Spiritual Heritage Foundation. Before we begin, let me invite Mr. Ritesh Malik, our national convener, to introduce our special guest, Mr. Manish, Consul General of India in Vancouver. Over to you, Ritesh.
Thank you, Satish ji. Namaste, everyone. A very warm welcome to all of you. Our special guest today, Consul General of India in Vancouver, Mr. Manish, is a career diplomat. He joined the Indian Foreign Services in 1997. In his over 22 years of diplomatic career so far, he has served in Indian missions in Moscow, Tashkent, Prague, Colombo, and Jakarta. In between his overseas assignments, he served in New Delhi at the Ministry of External Affairs, first as Under Secretary in the US and Canada Division and Foreign Service Institute, and then as Deputy Secretary in the United Nations Political Division from August 2004 to July 2007. He served as Joint Secretary in the Sushma Swaraj Institute of Foreign Service, and then as Joint Secretary managing India's bilateral relations with ASEAN countries. He's a passionate traveler and a food lover. He is deeply interested in strategic, trade, commercial, and development cooperation issues. Consul General Manish holds a BSc Honours degree in Physics and Bachelor's of Law degree from Delhi University. He fluently speaks Hindi, English, and Russian. Welcome, Manish ji, and over to you.
Thank you, Ritesh ji, for that eloquent introduction, and good morning to those in Canada, and good evening, good night to people in India. It is a great pleasure for me to be part of this interesting Ayurveda series, which has been conducted by Canada-India Foundation, along with the partnership with the Canadian Ayurvedic Practitioners Association, as well as our colleague Apurvaji in Toronto. And I believe that this series is going on for many months now. And today we have a special guest, Professor Dr. Narayanji Sahne, who would be giving a talk on Ayurvedic management of benign prostate enlargement. We'll hear from him a little later. But let me say that this is a wonderful initiative of CIF to promote Ayurveda practices in Canada. And I have been here for 8 months now, and I have seen that there is a lot of work going on by people or professionals or academics or businessmen or those who are lovers of Ayurveda or Indian practices of ancient wisdom, which we call Ayus, Ayurveda, Yoga, Unani, Siddha. And here in Western Canada also, we are putting in efforts to popularize this ancient wisdom by reaching out to people and doing advocacy. And I see that CIF effort is more towards promoting it and taking it into Canadian society so that there is a greater acceptance of this ancient practice in Canadian health system. As you all know, that this is the traditional system has a great interest in India, especially this is getting a lot more popular in the COVID pandemic times. We have seen a huge amount of growth in people following the ancient practices by adopting to various health benefits out of turmeric or intake of ginger or what we call other medicinal plants. Basically, this is a good sign, and this is an appropriate time when we can popularize Ayurveda in our daily health system, which can supplement the efforts of the modern medicine. Ayurveda is, as you know, is closely linked to the respect of Indian culture, gives to nature and the environment. Ayurveda takes care of many aspects. It ensures good health and a long life. Ayurveda could rightly be described as holistic human science, from the plants to your plate, from physical strength to the mental well-being. The impact and the influence of Ayurveda and traditional medicine is immense. Apart from curing existing ailments, Ayurveda also protects overall health of the body. No wonder that more than rog, Ayurveda talks about nirog. As I said, during COVID pandemic times, we have seen the demand for Ayurveda solutions steadily rising. And the current situation presents a right time for Ayurveda and traditional medicine to become even more popular globally. There is a growing interest towards it. The world is seeing how modern and traditional medicine both are important to further wellness. People are realizing the benefits of Ayurveda and its role in boosting immunity. People are making, as you know, we also make in our own home, a lot of Indians, kadha, basil, black pepper as an integral part of their lives. I would also like to urge that though this is a COVID times, and soon I think we'll win over the situation, and once again we'll restore the tourism sector. I think India has always attracted wellness tourism, and I think this is one aspect as through CIF and other interested body, consulate and high commission, we should all like to promote wellness tourism. Wellness tourism is very important in the sense that it will help people not only to see India, but also integrate the Ayurveda and traditional medicine in the holistic healing in various locations in India, be it Uttarakhand or Kerala. Ayurveda the popularity of Ayurveda provides us immense opportunity, and we should not lose that opportunity. And youngsters are also adopting various Ayurvedic products, and there is growing consciousness to integrate Ayurveda with evidence-based medical sciences. Ayurveda supplements are also getting popular. I would call upon the academicians, the promoters and propagators of Ayurveda, the doctors, the researchers, to deepen the research in Ayurveda. I would also urge the vibrant startup community to especially look up into Ayurveda products. One thing which I want to especially appreciate is that the youth have taken the lead to present our traditional forms of healing in the language that is globally understood. From the government point of view, I think Government of India is undertaking a lot of initiative to promote Ayurveda. We have been doing global Ayurveda conferences past 4 or 5 years, where Prime Minister himself addresses the participants. We have a month marked to Ayurveda Day. The Indian missions and high commissions and embassies also promote Ayurveda. India has set up a national Ayush mission to promote Ayush medical systems, which is cost effective. It is also working to strengthen educational systems. It is also facilitating the enforcement of quality control is very important of Ayurveda products. This is one thing which puts a barrier in kind of many of the developed world, where because of the quality control issue and the recognition issue. So as a stakeholders, we should try to kind of discuss with the health ministries of various governments in order to sort out this issue of recognition. And the government is also undertaking various quality control measures. Our policy regarding Ayurveda and other Indian system of medicine is already aligned with the traditional medicine strategy 2014-2023 of the World Health Organization. As you all would be aware, that World Health Organization has also announced setting up of a global center for traditional medicines in India. And many students, global students, are also coming to India to study this ancient wisdom, the art of traditional healing. And this is ideal time when we should make concerted efforts to promote Ayurveda globally. And in this context, CIF and Canadian Ayurvedic Practitioners Association and the efforts of our High Commission consulates to promote Ayurveda globally is very timely. And I look forward to having a fruitful discussion today on very special and thematic issue, which will benefit people of, especially men of 50 years plus who have this problem of prostate, and look forward from hearing from Dr. Narayan. Let me conclude my special remark by quoting Mahatma Gandhi, and I quote, he said 100 years ago, "I think highly of Ayurveda. It is one of the ancient sciences of India which ensure the health of the millions of thousands of people in villages. I advise every citizen to live life in accordance with the principles of Ayurveda. The pharmacy, the dispensary, and the Vaidyaraj all have my blessings that may be enabled to render the best possible services to Ayurveda," unquote. So as I said, Mahatma Gandhi more than 100 years ago recognized the ancient wisdom of Ayurveda and promoted it. And this sentiment is even more relevant today as we see the challenges of COVID pandemic, which is hitting not only the metropolitan, but also the rural side. Let us all work together in keep building on our achievements in Ayurveda and promoting it globally. Thank you very much, Satish ji and your team, for inviting me in today's series. And I wish all the best to the efforts of CIF and promoting Ayurveda in Canada. Thank you very much.
Thank you so very much, Manishji, for your very, very inspiring thoughts and great suggestion. Yes, we all need, I think, wellness at this very unprecedented time, and looking forward to, when situation gets normalized, India being a great, great hub for wellness, various retreat centers, and looking forward to that opportunity. Friends, let me now invite the speaker of this morning, Professor Dr. Narayan G. Shahane is a consulting Ayurvedic urologist and medical director at Brahma Ayurveda, world's first and only Ayurvedic Urology Center, multi-specialty hospital, research and academic center, Nadiad in Gujarat, India. He's practicing internationally in a highly specialized field of Ayurvedic urology with a very high success rate for over 17 years. He's managing disease of lower urinary passage like urethral stricture, BPH, enlarged prostate, bladder neck obstruction, interstitial cystitis, recurrent urinary tract infection, hypotonic bladder, and with Ayurvedic treatment, especially Uttar Basti, a highly specialized Ayurvedic urological procedure. We are looking forward to great presentation from Dr. Shahane. A very warm welcome, sir, for joining from India, and over to you. We are looking forward to your presentation. Thank you.
Thank you, Sateshji. It's really a very great honor for me that I'm invited to share my views on this specialized topic. And I'm highly delighted to see that all of you, I can see the efforts of especially Dr. Harish Sharmaji, the way he is trying to do kind of mass education, and the result is seen. The way Manishji has expressed his feelings, his knowledge regarding Ayurveda, and also Satishji, is really very great to see that everybody is getting aware of the basic principles of Ayurveda. It's not only Ayurveda, but the way you both explain is really great, that you are aware of basic principles even. So that's really very great. A very warm welcome and good morning to everybody. I'll start the session. Om Shri Dhanvantaraye Namaha. O Lord Dhanvantari, please shine something upon us so that we can reflect the world. Sarve api sukhina santu, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Let everybody be happy, healthy, and there should never be sorrow anywhere in the world. With this unique and basic philosophy of our culture, let us start this particular presentation. For everybody, this branch is totally new. But in Ayurveda, this urology branch is practiced since ages. The first reference is from the basic text of Sushruta Samhita. Maharshi Sushruta is supposed to be the father of human surgery. So there are many procedures, even like you can find the detailed description regarding the anatomy, physiology of this system in detail, diseases and their management. So here, it's not only the prostate, but I'm going to present the Ayurvedic management of benign prostate enlargement and certain urological disorders, and that too with an evidence-based approach. Welcome to world's first and only Ayurvedic Urology Center, Brahma Ayurveda, Nadiad, Gujarat, India. Let me explain certain basic things regarding the anatomy, the structures of lower urinary passage. Here you can see, here is the bladder for both. This is male bladder, this is female bladder. Then there is a tube which carries urine from the bladder to the exterior. That tube is called as urethra. Now in males, that tube is almost 20 centimeter long. In case of females, it is only 4 centimeters shorter. Now in case of males, just below the bladder, there is a gland which is called as prostate gland, which is encircling the tube of urethra. So this is the basic anatomy. Regarding the physiology, it's very interesting. According to Ayurveda, there is an energy which is called as Apan Vayu, which is a very crucial energy which governs the physiology of both lower excretory functions in both genders. Along with that, in males, it governs the physiology of semen. In females, it also governs the physiology of menstruation and fetus. The reference is from the Ashtanga Hridaya, the basic text of Ayurveda. Apano apanagaha, Shroni basti medra uru gocharaha, Shukrartav shakrun mutra garbha nishkraman kriye. That means this apan vayu. Actually, this energy is responsible for holding that particular thing up to certain limit. And once that limit is attained, the same energy expels it out. Like in case of urine, unless and until around 400 ml of urine is collected in the bladder, we never know about that. Once that much quantity is collected in the bladder, we get the urge. And as soon as we enter the washroom, the flow starts. So the same energy is holding urine up to that limit, and once that limit is attained, the same energy expels it out. It's a very crucial and complicated energy. Same with stools. Generally, a person passes motion once or maximum twice a day. Now, up to that limit, this Apan Vayu is holding the stools into intestines. Once that limit is attained, Apan Vayu expels them out. Same with semen. While having or performing sexual activity, the semen is held by the same Apan Vayu up to a certain limit. Once that limit is attained, it is expelled out. Now, same with menstruation. The innermost layer of the uterus, endometrium, is held by Apan Vayu up to almost 28 days. And after that, once that limit is attained, Apan Vayu will shed it off in the form of periods. The same interesting thing is with fetus. Apan Vayu holds the fetus up to almost 9 months. And once the term is completed, the same Apan Vayu starts the labor pain and there is childbirth. So this is very interesting and crucial energy for us. Urine is most important. So this energy is very crucial, Apan Vayu. Now the same thing happens. Here you can see both anatomy and physiology together. Basically, bladder is a bag made up of a muscle. That muscle is called as detrusor muscle. And just below the bladder, there is a wall or a sphincter. It is called as sphincter muscle, with which we are able to hold urine. Now what happens, as long as the urine is gradually getting collected into the bladder, this sphincter, this wall is tight. So it prevents the leakage of urine. But once the bladder is full, when we get the urge of urine, and as soon as we enter the washroom, what happens? The detrusor muscle contracts, and at the same time, this wall, the sphincter, relaxes. So the contraction of the detrusor muscle and means bladder wall, and at the same time, relaxation of this wall or sphincter starts the flow. This particular mechanism is called as detrusor sphincter synergy, and this is governed by the Apan Vayu. So this is very interesting. This is mentioned, very clearly mentioned in Ayurveda ages back. One more interesting thing regarding the pipe of urine, which carries urine from the bladder to the exterior, it is called as urethra. It has got very special qualities. Basically, it is a collapsible pipe, means it remains closed for 24 hours. It opens only when a person passes urine. And as soon as the urine is passed, it closes again or collapses again. That's why it is called as a collapsible pipe. So being a collapsible pipe, it has got its two distinct qualities. One is elasticity with which it can open up and close, and the other one is caliber. Caliber means the maximum extent to which that pipe can open up is the caliber of that collapsible pipe. So these two qualities are very much important for the normal functioning of this tube, that is urethra. Again, certain important things are mentioned in the basic text of Ayurveda regarding the natural urges. It is very clearly said that nobody should ever disrespect or neglect these natural urges like vegan nadharet, vata, wind, mutra, kshava, trut, kshudham, nidra, kasa, shama, shwasa, jrumbha, shruchar, diretasam. The natural urges like flatus, stools, urine, sneeze, thirst, hunger, sleep, cough, heavy breathing on exertion, yawning, tears, vomiting, and semen ejaculation should never ever be neglected, or they should not be forced. So in this, urine is very important. So what happens if a person ignores the natural urge of urine or suppresses the natural urge of urine? It is mentioned in the Ashtanga Sutrasthana as Anga Bhanga Ashmari Basti Medra Vangshan Vedanaha Mutra Serodhat Purvecha Prayo Rogaha. So there are certain complications of ignoring the natural urge of urine and their body, urinary stones, pain in the bladder, penis, and pelvis. According to another text, Charak Samhita, Basti Mehanayoho Shulam Mutra Krucham Shiroruja Vinamo Vangshan Anaha Syatalingam Mutra Nitrahe. Pain in the bladder and penis, dysuria, headache, stooping down because of that pain, and pelvic pain. So these are the complications of holding urine for longer durations, though the bladder is full. So one of them is Mutra Kruchram. Actually, the scope of this is very big according to Ayurveda. Different entities, different urological conditions come under this title. So this is very significant. So in short, there are many diseases of lower urinary tract. The list is here. The first one is benign prostate enlargement. Then post transurethral resection of prostate. This is surgery to remove the prostate. Post TRP status. This is again a complication of the surgery. We will discuss regarding this later. Then urethral stricture, bladder outlet obstruction, interstitial cystitis, recurrent and multi-drug resistant UTI, hypotonic bladder, neurogenic bladder, incontinence, etc. Basically, all these conditions are so nasty, and in fact, in modern urology, there is no significant or promising treatment for these conditions. And in Ayurveda, yes, we have very promising treatment for all these conditions. We'll discuss regarding that also. Now, when we say the diseases of lower urinary tract, there are certain common causes of all these conditions. The list is here. The first one is Vegadharan. Vegadharan means neglecting the natural urges governed by especially Apan Vayu like urine, stools, etc. Next is Vegodhirana, means forcing the urges governed by the same Apan energy like stools, urine. Then iatrogenic, any kind of instrumentation or surges on the lower urinary tract, trauma on the lower urinary passage, recurrent stones, urinary tract infection, unsafe sexual practices, idiopathic, means no exact cause can be established, means idiopathic, and aging, especially in case of bladder, in case of diseases of bladder and prostate. Aging is also a very important factor. There are certain symptoms. They are called as lower urinary tract symptoms, in short, LUTS. They are classified in 3 different groups. The first is storage LUTS. Means while the bladder is getting filled, the symptoms are frequency. That person has to visit washrooms very frequently. Urgency is there. Once that person gets the urge, that patient has to rush to the washroom, there are chances that urine may get leaked out. Nocturia, that patient has to visit washroom many times during night, which disturbs sleep. Urge incontinence, whenever that person gets urge, that person has to rush or few drops get leaked out. Nocturnal incontinence, that person's urine leaks during sleep. Stress incontinence, urine leaks while coughing or sneezing. Incontinence, urine leaks continuously, and pelvic pain. These are storage LUTS. Now the next class is voiding LUTS. Means when that person is passing urine, these symptoms are felt. Incomplete emptying of the bladder. Then episodes of near retention, means urine gets blocked, almost blocked. avoiding small amount or volume of urine, spraying or double stream of urine, hematuria means blood in urine, burning and dysuria means painful urination, straining to pass urine, hesitancy means difficulty to start the flow, poor flow, dribbling, drop by drop urine, and intermittency means the flow starts this way, interrupted flow. These are voiding LUTS, and the last is additional LUTS like hemospermia, means expression of blood with the semen, retrograde ejaculation, the semen which normally should get out of the penis, in fact it is diverted to the bladder. This is called as retrograde ejaculation. Discharge from the urethra, reduced ejaculation force, pain in the scrotum or testicles, dyspareunia means painful sexual activity, and fever with chills and rigors. So these are in general common lower urinary tract symptoms. Now the most important part for everybody is how we can prevent these diseases. So there are certain preventive measures which are very important. The first one is there should be proper water or liquid intake. Actually, it is never in the form of liters. Most of the urologists advise the patients to drink water in terms of liters, like 4-5 liters, 3 to 4 liters, 4 to 5 liters, but it is never in terms of liters. In fact, this intake is always decided by the color of urine. So one must always observe the color of urine. It should never be dark yellow. Yes, straw yellow, pale yellow is fine, but the color of urine should be as close as like water. So it's very clear that if a person is living in cold atmospheric conditions, perhaps only 1 to 2 liters of water will be enough to maintain the concentration or the acidity of the urine like water. If a person is working in the sun, he's doing some hard work and he's sweating a lot, in that case, though that person is drinking around 10 liters of water, but still that person may pass yellow urine. So he needs some more water. So definitely the need of a water is decided by our body and not by any urologist. So this is very interesting and important fact for everybody to know. Second is one should always respect the natural urges. Many people, they hold urine, especially when they are busy with certain meetings or work. Though the bladder is full, they keep on working. They hold that natural instinct of urine. This is very bad. So one should never ever neglect that natural urge. So one should always respect the nature. Local hygiene, of course, is very important. Safe sexual practices. One should avoid cold drinks, avoid stale or leftover food, avoid late nights, avoid sleeping during day. Regular physical exercise is really very important for the normal functioning of urinary system. Obviously, there are certain yoga asana like Vajrasana, Parvati Asana, butterfly posture, Pavan Muktasana, etc. They help. Surya Namaskar also help a lot. And pranayam, all pranayam. Now regarding Ayurvedic urological treatments, it is certain oral medication, then Uttar Basti, then calibration of urethra, Basti Dhava means bladder wash, Yoga Karma and Kala Basti, and Yoga and Pranayam. So all these treatments are very clearly and mentioned in classical Ayurvedic texts since ages, and that too with detailed description of all the procedures. So we'll discuss all the procedures in short in later slides. So first of all, Uttar Basti. It is a highly specialized Ayurvedic urological procedure. It is a non-invasive procedure with minimal or no pain. There is no need of anesthesia. Even urethral catheterization is not required, means there is no need to introduce a tube inside the urethra or bladder. It is a daycare treatment. No rest is required. Patient can resume his or her daily routine or daily work immediately after the procedure. And even today, this is proving to be a very promising treatment. In fact, this is the answer to many conditions which we discussed earlier. In modern urology, most of the diseases are treated with surgical treatments. And here, there is a non-surgical and very promising answer for all these conditions in Ayurveda in terms of Uttarbasti. Let us see the video of Uttarbasti. In this, we introduce an oil-based medicine or a water-based medicine into urethra with a syringe, and for that only a small adapter is used. Through that, we introduce that medicine. The medicine is introduced very gently, very gradually. The whole medicine goes to the bladder, and from there it works. The procedure is almost painless. Yes, little discomfort is there, but it is manageable. As I mentioned that I'm practicing in the field since last more than 17 years, and we are managing the patients with this particular treatment. We have managed patients from the age of 8 to the age of 92, and all the patients tolerated the procedure well. It is very important that procedure has to be conducted by an expert under very rigid aseptic precautions. Mostly all the disposables are used, like disposable syringe, everything is disposable. Even the medicine is sterilized. The most important part while performing this is the medicine, everything should be conducted under very rigid aseptic precautions. After introduction of the medicine, we fix a penile clamp on the penis. We keep it there for 5 minutes to maintain the maximum concentration of this medicine inside urethra. In case of females, we do the same way. There is also no need to introduce a catheter inside the urethra or bladder. Just introduction of that oil-based or water-based medicine. Now the dose of that medicine is different for different conditions. When it is oil-based medicine, it is around, generally it is 60 ml. In case of water-based medicine, it ranges from 60 ml to almost 500 ml. After the procedure, patients are asked not to urinate for a couple of hours. Now the next condition is calibration. Now, as far as calibration is concerned, it is mentioned again in classical texts of Social Samhita. At that time, they were using different things. Instead of catheters, they were using cannulas made up of either gold, silver, copper, and even the stalk of lotus. They were used to introduce inside the urethra for all these conditions. Here you can see the calibration is required to restore the caliber of it. There are certain conditions when the caliber of urethra is lost. So we need to do the calibration to restore the caliber. And for this procedure is done. Now, obviously, we do this procedure after certain settings of Uttarbasti when the urethra is prepared for this. And even this procedure is absolutely painless. We introduce the catheter very gently. Initially, we start with small one, then gradually increase the size of the catheter. And here you can see it's not only painless, but it is bloodless as well. There is not even a little blood stain on the catheter, you can see. And even after the calibration, the process of calibration, patient can resume his or her work immediately. So this is the beauty of Ayurvedic treatments. Actually, it's very interesting that most of the urology departments are always flooded because most of them, they do not have proper control. And that's why whenever a person calls urology department, a patient calls urology department, they ask that patient, can you hold? It's something interesting. Now we'll turn to the basic topic, benign enlargement of prostate. So here you can see the bladder, this is urethra, the prostate, this is normal prostate, which is encircling this tube, urethra. Now, as long as it is normal, you can see the base of bladder is slanting and the urine can flow very easily outside the bladder through this tube. Basically, prostate enlargement is a result of aging. So as age increases, as a person grows, obviously after certain age, especially after the age of 40, as Mr. Satishji rightfully said, that after the age of 50 years, almost 25% of the population, male population, suffers with some kind of problem related to prostate. By the time they reach the age of 70, is almost 100%. So there is some kind of enlargement is there. It is the result of aging. So it is almost inevitable. It is there. But yes, with certain like asana, pranayam, surya namaskar, etc., we can slow down the process of aging. We can slow down the process of enlargement of prostate. So this is very important. So what exactly happens when the prostate enlarges? When it enlarges, you can see here, with increasing size, it compresses the urethra, and thus it offsets the flow of urine. So urine, the way it should get out, is not getting out. So the flow gets obstructed. At the same time, you can see here the bladder base is slanting, it is going down here. Because of the enlarged prostate, the bladder base is pushed upward. And when it is pushed upward, just around this bladder neck area, some amount of urine is always remaining there. Though the patient is passing urine, even after passing urine, some amount of urine always stays there. This is called as post-void residue, which is not good. So these two things happen. Now to more few things regarding enlargement. We'll move to next slide. Look, as far as prostate is concerned, that gland is made up of almost 5 lobes. Here you can see this is the anterior lobe, this is urethra, and the prostate is encircling the urethra. This is anterior lobe, these two are lateral lobes, this is median lobe, the pinkish, and this is posterior lobe. So if there is even little enlargement in this median lobe, this is median lobe, this is urethra. If there is even little enlargement in the median lobe, that immediately compresses the urethra. It will pressurize the urethra. Here also you can see. And patients suffer a lot with obstructed flow and all the symptoms. If there is growth in especially the lateral lobes or anterior lobe, it won't affect that much the flow of urine, because the growth of prostate is on lateral sides. So in our clinics, we routinely see that patients come to us with very little increase in the size of prostate, very small enlargement, but still the symptoms are very aggressive. That means the median lobe is enlarged and it is compressing the urethra. It is also pushing the bladder base upward like this here. And we also see patients, actually the normal prostate size is less than 20 cc or 20 gram. We have seen patients with like 27 gram, which is not that significant size wise, but when the median lobe is significantly, like the maximum enlargement is in the median lobe, at that time the symptoms are very high. And we have seen prostate of almost 70 grams, but patient is unaware of that. And when patient goes for that ultrasound report for other cause, at that time he knows regarding this that there is enlarged prostate and there are no symptoms, because in that case the lateral lobes are enlarged. The chances of malignancy or cancer are higher in posterior lobe. So this is general description or anatomy of prostate enlargement. Now the specific symptoms, lower urinary tract symptoms are there, like frequency, urgency, nocturia, hesitancy, difficulty to start urine flow, weak stream of urine, intermittency means the flow or stream of urine starts, stops, interrupted flow, dribbling at the end of urination means though the patient feels that now the urine is passed, but still few drops like they are getting out, and incomplete emptying of the bladder. Diagnosis is with proper history taking. We need to check proper history of that patient's complaint history. Then clinical examination, especially the per rectal digital examination. In that, the doctor introduces the finger inside the anus to check the size of the prostate, size and consistency of the prostate. Normally, the prostate is not palpable, but when it is enlarged, it is easily palpable. Then ultrasound sonography of the kidney, ureter, bladder, and prostate is quite diagnostic. Like in this USG picture, you can see that this is the prostate which is enlarged, and this is the cavity of the bladder, which is like pushing the bladder. And TRUS, transrectal ultrasound. In that, the same USG probe is introduced into the rectum to scan the prostate. Along with that, there is one more important tumor marker. It is serum PSA, prostate specific antigen. It is a blood test just to rule out that there is no malignancy or cancer. But sometimes, even with inflammation of the prostate, it increases. So, an experienced urologist is very important to judge whether that increase in the serum PSA is because of the prostatitis, inflammation of the prostate, or because of the malignancy or cancer. Now, as far as modern urological medicinal treatment is concerned, there are certain drugs which are used in the management of enlarged prostate. The first group is alpha blockers. These medicines, they help to relax the muscle of the bladder. And if the bladder muscle relaxes, especially during night, especially there is significant nocturia, that patient has to visit washroom many times during night. So to get a proper sleep, to relax the bladder, these medicines are used. Once the bladder gets relaxed, obviously it is able to hold significant, like more amount of urine, and that person need not to wake up during night. And the drugs used are terazosin in this group: terazosin, doxazosin, tamsulosin, alfuzosin, and silodosin. But all the drugs are associated with significant side effects. And they are postural hypotension, dizziness, headache, pounding heartbeat, and weakness. Another group is 5-alpha reductase inhibitor. These medicines, actually finasteride and dutasteride, these medicines after long-term use show significant improvement even in the size. The size also decreases. But again, significant amount of side effects are associated with these drugs, and they are erectile dysfunction, ejaculating too early or taking too long to ejaculate, excess fat development and tenderness around breast area, rash, feeling sick, vomiting, darkening and thickening of facial and upper body hair. In Ayurveda, definitely we can manage prostate enlargement without ill effects. That's the beauty of Ayurvedic urological treatments. There are certain oral medications like Goksharadi Gugulu, Chandraprabhavati. Then in case of severe symptoms, when the flow is very significantly obstructed and that person has to visit washrooms like almost 10 to 12 times during night, we go for Uttar Basti. When the flow is very poor, we go for calibration of urethra as well. And this gives very quick and significant clinical improvement in the condition of the patient. Along with that, we go for Basti, Yog Karma or Kala Basti. This is classical detoxification procedure of Ayurveda, one of the Panchakarma, one of the 5 procedures, Basti. These are different courses of Basti, Yoga or Karma or Kala, according to the duration. And this is done for the regulation of Apan Vayu and restoration of the physiology. Because here you can see the physiology is badly disturbed, physiology of urination or micturition. Along with that, certain yoga and pranayam like Surya Namaskar, Parvati Asana, butterfly posture, and pranayam, they also help significantly. Here you can see the way Ayurvedic treatment improves the condition of benign prostate enlargement without side effects. It takes almost 6 months, 3 to 6 months. In fact, the clinical improvement is very fast. Clinical improvement in the condition is seen within 2 to 3 weeks once we start the treatment, the medicinal treatment. And here you can see this patient, we started his treatment in March 15. At that time, the volume of prostate was 44 cc or 44 gram. After 6 months treatment in September 15, that size from 44 cc reduced to 19 cc or 19 gram. This is very significant. This is possible with Ayurveda, that too without ill effects. Now, as far as surgical treatment of enlarged prostate is concerned, TURP, the transurethral resection of prostate, is supposed to be the gold standard in the management of benign enlarged prostate. In this, they introduce a scope and they just scoop it off. The part of prostate which is compressing the urethra, it is removed. It is debrided. But though it is a gold standard, but unfortunately the outcome is not really very promising. And most of the patients, they suffer badly with certain things after the surgery. It is called as post-TRP status. There is bladder neck stenosis. The bladder neck gets tight. Urethral stricture. Many patients suffer with this condition. The tube gets narrow and even incontinent. So varying degree of lower urinary tract symptoms are seen, and the patient has to go for certain investigations like ascending urethrogram. This is ascending urethrogram, ultrasound sonography, cystourethroskopy. And again, there are modern treatments for this. They are clean intermittent self-catheterization. That patient has to introduce catheter on his own into the urethra. Then sometimes they repeat the TURP process. In case of bladder neck stenosis, tight bladder neck, they do bladder neck incision surgery, then urethral dilatation for stricture and visual internal urethrotomy, VIU. Again, for this condition, we get many patients of this particular post-ERP status, and we do manage such conditions with Uttarbasti calibration and oral medication. Just presenting an interesting case of this condition. This farmer, 63-year-old patient, underwent TRP in September 2014. Unfortunately, he developed stricture, and within just 2 months of the surgery, he has to undergo cystoscopy and urethrotomy to address the stricture. And after that, he was advised to use the self-dilatation or self-catheterization with 14 French catheter daily. Within 1 year of the surgery, he has to undergo one balloon dilatation for stricture because stricture recurred. And after that, he was using the same self-catheterization, and still his flow was very weak. You can see that particular patient's X-ray ascending urethrogram. The bladder neck is tight. There is TRP defect and the stricture. His flow was very poor. You can see in this uroflowmetry report, the max flow rate was 4.2. It should be at least 15 ml per second. In case of prostate or in case of post-TRP status, it is allowed even below that, even up to 10. Average flow rate was 1.7. After our treatment, Uttarbasti calibration and certain oral medication, you can see it is 14.6. The flow improved significantly, and since then he is leading normal life. This is possible with Ayurveda. Now the next condition, urethral stricture. This condition is a condition in which the pipe of urethra gets narrow or blocked. As far as the modern urological treatment is concerned, there is no medicinal treatment for this condition. Only surgical treatment of urethral stricture is possible or mentioned in urology. It cannot be cured or managed with only medicines. So surgical intervention is must. And the options are urethral dilatation. Under anesthesia, they introduce different size dilators into the urethra to open up that constricted part. It is a surgery, painful, post-op period, bleeding is there. And even after this, generally stricture recurs within 1 year of the dilatation. Then the second option is urethrotomy, visual internal urethrotomy or direct visual internal urethrotomy, in that they introduce a scope inside the urethra and they cut open the constricted part of urethra, either with a blade or different types of laser like thulium or holmium laser. And even after this, the stricture recurs generally within 1 year of the surgery. That's why most of the urologists ask that patient to go for that clean intermittent self-catheterization or self-dilatation to maintain the caliber of urethra after the surgery. But even with that, it recurs. And after going through 2-3 surgeries, generally most of the urologists ask that patient to go for urethroplasty, which is supposed to be the last resort for the management of urethral stricture. It is a major surgery, open surgery, a big wound, and unfortunately, even after urethroplasty, the stricture recurs. And that's why it is believed in urology that once is the stricture, always is the stricture. We know that results of conventional urological treatments are not really very promising. And despite of those much advancement in modern urology, the treatment of urethral stricture remains a challenge. Now, what we have to offer in Ayurveda, a very promising treatment, Uttarbasti, for most of the patients, 20 settings, calibration of urethra, and oral medications like Raktamedo Pachakvat, Ushirasavam, and tablet Sanshulani. Here I am presenting very interesting case of this particular disease. This lady, a 58-year-old lady from USA, California, a homemaker, was suffering with stricture since 2001 and has to undergo dilatations every 6 months, or urine flow used to stop completely. Unfortunately, she suffered complete retention, urine flow completely stopped on 15th of October and has to undergo suprapubic catheterization in emergency. Means in that, they pierce the abdomen and introduce a tube to evacuate the urine into the bladder. After that, after a series of investigations, he was advised to undergo urethroplasty in December 12. When they actually posted the surgery on 23rd of January 13 in California, when they tried to introduce a cystoscope, that took pediatric cystoscope, the smallest one, 10 French size, they could cannulate urethra for hardly 0.5 centimeters. Then they tried to introduce a guide wire, which is thin like the ball of a ball pen. When they tried to introduce that wire, even urethra was not negotiable with that wire. Then they tried to introduce the same guide wire through that hole which was made on the abdomen, the suprapubic. Through that approach, also the urethra was not negotiable. So obviously there wasn't option, and they have to abort the procedure. And they explained that lady that she has to lead rest of her life with this tube only. There was no hope. Because for most of the people, once the doctors of USA say that there is no hope, that means there is no hope at all. So what next? Her daughter searched on the net. She got our website. The name itself is cureurethral.com. She communicated with us. It was very hard for them to believe that an Indian doctor, that to an Ayurvedic doctor, says that it is curable. How come? And we have a policy that unless and until each and every doubt of each and every patient is absolutely satisfied, we never start the treatment. Ultimately, that lady came to us. We started her treatment on 20th of April 13. Within 10 days, on 29th of April 13, we were able to remove her suprapubic tube with normal urine flow. A lady who was unable to pass even a single drop of urine, you can see the report of uroflowmetry. That lady passed urine with a maximum flow rate of 16.8 ml per second. It should be at least 15 ml. The average flow should be around 10 ml. It was 12.4, and that too without straining. This is possible with Ayurveda. And not only this, but after completing her treatment in April 13, she went back to USA. After almost 3.5 years of her treatment, in December 17, when she came back to India, we underwent one more uroflowmetry, and you can see even after 3.5 years of her initial treatment, her flow was absolutely normal. A lady who has to undergo dilatations every 6 months, and this been more than 8 years, that lady is leading absolutely normal life. This is what Ayurveda can contribute in this particular branch of Ayurvedic Urology. One more case, this male patient, 65-year-old, came to us with the same kind of suprapubic tube. You can see this X-ray. When we introduced the dye to check the urethra, status of urethra, the dye got here. It didn't enter the bladder. Here also you can see, even after force flow injection, it didn't enter the bladder. After the treatment, you can see here the dye has entered up to the bladder normally, and then we removed the suprapubic tube. One more case of this same condition. Because for this condition, there is no promising treatment in modern urology. This guy, a software engineer, basically Chennai based but living in USA again, underwent his first surgery, telescopic surgery in November 11. Then next scopic surgery he has to undergo within 1 year. So stricture recurred in December 12. He underwent one more surgery. Exactly after 1 year of that, in December 13, his flow again got compromised. He came to us. We managed him at that time. His flow was very much compromised. We managed him with Ayurvedic treatment, and everything came back to normal. After his treatment in December 13, he went back to USA. Came back in December 17 after 4 years of his treatment. And even after 4 years, his uroflow was absolutely normal, and he's been again almost more than 8 years. He is leading absolutely normal life with this miraculous Ayurvedic treatment. Look at this guy. Underwent these much surgeries. One of them is urethroplasty, but still he was suffering. He has to use that self-catheterization to pass urine properly. And despite of using this catheter every day, his flow was very much compromised. It was only 6 ml per second. After our treatment, everything improved. And since May 16, he is leading normal life. Now, the next condition is bladder outlet obstruction. This is kind of functional obstruction, bladder outlet or bladder neck obstruction. A blockage at the base or neck of the bladder, which reduces or stops the flow of urine, causing some back pressure effects like hydronephrosis and hydroerythema. There is significant amount of swelling on the kidneys and the pipe carrying urine from kidneys to the bladder. Now, this is very interesting that this condition is, regarding this condition, there is very proper description you will find in Ayurvedic texts. The basic cause behind this is Vegadharan, means neglecting the urge of urine. And that disturbs that energy upon life. And that's why when that person enters the washroom, when the bladder is full and enters the washroom, ideally, as soon as the person enters the washroom, this muscle should contract. At the same time, the wall should open up and the flow starts. But in such patients, what happens? Though the muscle contracts, this sphincter or wall is unable to open up. And obviously, there are certain storage and voiding LUTs. This case, this young chap of 23-year-old from Sydney, Australia, a student. When he came to us, his history is very interesting. He had an incidence of involuntary passage of urine in school when he was in 4th standard. Now imagine, a 4-year-old kid passes urine in the school in front of everybody. Everybody laughs at that kid, and that kid gets like scared that he may pass urine in front of everybody at any time, and he starts holding the urine, and that results into bladder outlet obstruction. He underwent many treatments in Australia, in USA, but in vain. With this basic Ayurvedic treatment, you can find his condition improved significantly. Within 1 week, he was able to pass 100 ml of urine without any problem. And he improved totally. You can see here his sonography before treatment. The remaining urine in the bladder was almost 660 ml, and after treatment, almost 6 months of the treatment, the residue was only 50 cc, though. So the condition improved very significantly. One more condition is the interstitial cystitis. This is again a very, very problematic condition. Like you can see, that person has to visit washroom 60 times a day, up to 60 times a day. Very painful condition. This case, this guy was suffering since 4 years. His bladder capacity was reduced to 117 cc, and he was advised a major surgery of augmented cystoplasty. Means they use colon to reconstruct the bladder to increase the capacity of bladder. And then he came to us with Ayurvedic treatment. His bladder capacity improved to 400 ml without surgery, almost normal. And since October 16, he is leading absolutely normal life. This is again a very burning issue of the era, recurrent UTI or recurrent multi-drug resistant UTI. This patient of UTI came to us. He was suffering since 2 months. Being a father of a doctor, he was managed with antibiotics. He was hospitalized, but still there wasn't improvement. When he came to us, you can see we managed this condition with Basti, Dhawan, bladder wash, Uttar Basti, and oral medicines. When he came to us, you can see on 15 July, the total WBC count was 20,180, which is very high. This shows significant infection, septicemia almost. Within 4 days, 15 July, 19 July, that came to normal. Actually, clinical improvement was there within 24 hours. And within 4 days, actually most of the people believe that Ayurveda, when they take Ayurveda treatment, they believe that it takes longer time to get results in Ayurveda, but it's not true. Here you can see within 4 days, when a person was suffering since 2 months, within 4 days, with only Ayurvedic treatment, without antibiotics, his condition improved completely. There is one more condition, last condition we are going to discuss here, hypotonic bladder. Actually, due to over distension of the bladder, it occurs, or some lower motor neuron lesions are also there. This guy, at the age of 79, he underwent one surgery over there, hernia surgery, And after that, he suffered complete retention. And when they evacuated the bladder, it was 1,800 ml urine. So the bladder was traumatized because it was over distended. And after that, he suffered hypotonic bladder, means his bladder lost the tone, and he has to, that doctors has to keep the tube, and he was unable to pass urine at all. And because of that catheter, he was suffering with severe burning pain and recurrent infections. When he came to us, we started his treatment with Ayurvedic treatments. You can see underactive recruiter in the aerodynamic study reports. He was unable to pass even a single drop of urine in this study. With Ayurvedic treatments, we removed his catheter on 22nd December 19, and after that he never ever suffered retention of urine, and since then he is leading absolutely normal life, and now he is passing around 400 ml of urine with complete satisfaction of passing urine without residual urine. Along with this condition, we also manage different conditions like urinary stone, incontinence, enuresis means bedwetting, neurogenic bladder, because all these conditions do not have promising treatment in modern urology. So the fact is, Ayurvedic urology is a branch with promising non-surgical and quick treatments for many urological conditions. This branch needs further research and can do miracles. Now, as we are discussing the issues of urine since almost last 1 year, and the thing is, you can now imagine the life of a urologist is always associated with urine. That's why it is said that the urologist's favorite keyboard shortcut is Control P. And yes, it is said that 4 out of 5 urologists smell their apple juice before the drink. I was invited by Ayurvedic Society in Japan to deliver the lecture in the 42nd General Conference in Osaka regarding Ayurvedic urology. A delegation of doctors from Japan came to us to know regarding Ayurvedic urology. I was invited to Japan to deliver lectures. One more team of doctors from us from Japan. Different doctors from different countries like Russia, Singapore, Egypt, and Algeria. They came to us just to know the things regarding Ayurvedic urology. Here's a small introduction of our institute. Thank you. Thank you very much for a patient listening. I would like to especially thank Dr. Harish Verma Sarji, President of Canadian Ayurvedic Practitioners Association, for inviting me and giving me this opportunity and honor to share my views on this particular topic.
Thank you so very much, Dr. Shahane. What an enlightening and very, very informative presentation you have given. we were completely, I think, immersed into your presentation, and our sincere gratitude to your commitment and leadership for promoting Ayurvedic way of living life. You not only touched upon that how we can cure the disease, but also how we can prevent it. But what are the, I think that's all about Ayurveda, that how we can adopt certain things in our lifestyle to live a very happy and healthy life. We are pressed with the time. I would like to invite Dr. Harish Verma to have some, I see in our panel, I think few questions are there, and maybe we can have a few questions, even though we are a little going out of time. But I think we should take use of our Vedya's time. Over to you, Dr. Verma.
Thank you, Sriji. And first of all, I'll congratulate Dr. Narayan Shahane ji for such a informative, integrative, and a scientific presentation. Fantastic. And I'm sure all our viewers in the West must have understood such a technical subject very easily because of his presentation. It was very interesting. It's an integrative of, this is the exact model what we want, integration of Ayurveda and modern science. It's fantastic. I got few questions, but we cannot take all the questions. Dr. Shahane, I have two questions which are very important. How a common man can know whether he is having benign enlargement of prostate or a cancerous enlargement of prostate? Because people are afraid of, and how they can come to know. I know it has to be diagnosed by the doctor, but from the common man point of view, how the people can, whether they have benign enlargement of prostate.
Very good question. Actually, it's very interesting. Basically, the thing is, the symptoms, as far as the lower urinary tract symptoms are concerned, they are almost same for both cases, whether it is cancerous enlargement or benign, means non-cancerous enlargement. The symptoms are almost same. But when there is cancerous enlargement, there are certain additional symptoms like weight loss. Along with that, certain disturbed lower excretory functions, especially the lower excretory patterns are disturbed, especially the patterns of stool are also getting disturbed. So these are like very few things, but for proper diagnosis, a patient must visit an expert, a urologist, to know the exact condition. The PSA, again, the prostate specific antigen is a cancer marker. The normal range is up to 4. But still, like we have seen many patients who come to us with very high level of PSA, but still it is non-malignant. When they go for biopsy, it is non-malignant, because sometimes even with inflammation of the prostate, the PSA increases significantly. So definitely it is a kind of tricky thing, and let the urologists do their job. So at like personal level, for a layman, it's quite difficult to judge whether it is cancerous or non-cancerous growth.
And the second question is whether the cold weather or the antihistaminics, the allergy medicines, can they increase the symptoms of benign prostate enlargement?
Yes, definitely. Because in cold weather, obviously the GFR, the glomerular filtration rate of kidneys, in short, the filtration rate of kidneys increases significantly. So more the rate of filtration, more the production of urine. If the production of urine is more, obviously bladder gets filled very quickly. And that again affects the overall lower urinary tract symptoms. So it aggravates. Even with the same thing is with the allergy medicines. They also.
Thank you, sir. Thank you very much. Thank you very much. Sriji, over to you. And rest of the questions we will answer separately through the email from CIF. Thank you, sir.
Thank you. Thank you very much, everybody. The whole team of Canada India Foundation, Mr. Satish ji, Mr. Ritesh ji, for inviting me, and especially Mr. Manish ji for giving me this opportunity and being there with me for this session. Thank you. Thank you very much.
Thank you, Dr. Shahane. Thank you so very much for taking time out and I've seen in the chat, I think some of the participants from this part of the world who have been treated by you has also participated, and they were kind of giving the testament that how they are feeling normal after getting treatment through you. Thank you for your commitment and your promoting Ayurveda. Before we do the concluding remark, I would request Manish ji, thank you for joining the whole session, and you are listening very intently, and some thoughts you would like to share before we do the concluding remark.
No, I think it was very eye-opening, and as you correctly said, it was explained in scientific manner with pictorial things, and it was a learning experience for me also, and an eye-opener for me also, that when modern medicine fails, when people fall back to Ayurvedic way of treatment. So I think the message should go to the people in general that, when you have kind of such kind of symptoms happening to you, why not approach the Ayurvedic way and get treated in the first instance. We need to have faith in our ancient wisdom, which has been documented and through ages. So we need to kind of support such kind of solutions from the very beginning. And also I saw some questions in the chat, why such, maybe doctor can reflect and comment as a parting this, why Western system is not accepting the treatments which we are providing in Ayurveda. So thank you very much, and it was quite educative and eye-opener for me also, and we hope that whenever such references comes to us, we'll direct them to our such an important institution in Gujarat. But maybe this doctor can comment on why there is a hesitance in the Western world of when such a treatment is available.
Dr. Shahane, over to you. Thank you, Manish, for a very nice question.
Great. That was actually, I was expecting this kind of question. What happens for most of the people, they don't know about Ayurveda, and this is kind of mass education we are trying. We are promoting this branch. Even unfortunately, even doctors don't know about this particular branch. That's why we are like being the world's first and only Ayurvedic Urology center. We are always trying to propagate and spread the word about this knowledge everywhere. In fact, what happens whenever a patient, being a patient, when he realizes, when he comes to know about us or Ayurvedic urology, that patient goes to his or her doctor at that place, especially the modern urologists, and they are not aware. In fact, most of the urologists, they are not at all interested even to know about this. But like I shown you certain images that many doctors from different countries, they visited our center to know what exactly Ayurvedic urology means. So this is just the beginning of this particular branch, and we are trying to propagate it as much as possible. So let us hope for a bright future for this branch also, and people will also realize very soon. So it will take some time, because it's very hard for them to believe. Even for most of the doctors, most of the patients, it's very difficult to believe that there are certain conditions for which there is no promising treatment in modern medicine, modern system of medicine. And when we claim that there is promising treatment in Ayurveda, it's very hard for them to believe. And that's why they are not coming to us at like straight away. In fact, it's a challenge for us, and we are accepting the challenge. We are fighting for that. Let us hope for the best. Thank you.
Thank you, Dr. Shahane. To you, absolutely, at the Canada India Foundation with Canadian Ayurvedic Practitioners Association, of course, Indian High Commission and all the Consulate Office and Vedic Spiritual Heritage Foundation, we've been working on that, how we can promote Ayurveda and how we can create an environment for the integrated healthcare, which is, I think, the future, or we can say the need of the hour. And in this regard, I would like to mention that recently we concluded our healthcare summit, in which we have partnered with the UHN. UHN is Canada's #1 university health network and a research hospital, chain of hospitals, and also #4 in the world. To do a research, we are kind of a gathering $1 million funding for a research on integrated research on combining the modern medicine as well as the Ayurvedic way of our treatment on 4 key chronic diabetes, kidney, cancer, and heart disease. So we are looking forward to working closely on that, how we can promote Ayurveda in this part of the world. And today's session, and first and foremost, I must thank you, Dr. Shahane, for your very, very interesting, very enlightening, and as rightly Dr. Verma said, very scientific presentation. Sincere thank you. And keep up doing good work. We look forward to staying connected with you. And Mr. Manish, I know it was very early morning, and thank you so very much for joining and listening the whole presentation. We look forward to staying connected and looking forward that combined to unitedly or together how we can work on in this field. I just also want to mention that we are celebrating International Day of Yoga. I know the celebration has begun Vancouver, in Toronto, and all other parts of Canada. I've seen some of the sessions happening in Vancouver also. So on June 20th, we are mounting 2 sessions in the morning from 10 a.m. to 12 p.m. Where along with the Ministry of Ayush, and we are picking up a topic on cardiovascular prevention and rehabilitation, an integrated approach. So same way of combining both the knowledge of the modern medicine and Ayurvedic, that on cardiovascular related issues, how a synergy can be created in an integrated medicine. And in the evening from 7 p.m. we are doing a very interactive discussion with Sister Shivani of Brahma Kumaris on open minds, healthy minds, on mental health and addiction related areas. So our ancient wisdom has a lot to offer. It's a need of the hour that how we can promote at the Canada India Foundation level. We are working on that direction. And our sincere thanks to our partnering organizations, of course, Dr. Harish Verma from Canadian Ayurvedic Practitioners Association, Vedic Spiritual Heritage Foundation, and Consul General of India in Toronto office, and Y Media, who's been promoting our various events, helping to reach out to the community at large. We thank all, and thank you all the participants. Please do share our information, and please do spread these very informative sessions to your family and friends, and please request them to join. Stay tuned for our next session. Every other Sunday we've been hosting, and stay tuned with the CIF. We look forward to hosting you in our next session, and have a safe and healthy week and days ahead. Thank you all. Namaste.
Namaskar.